Thanks to everyone for joining us, and thanks so much to the American Academy of Neurology for hosting us. Our goal for tonight is to really give you a sense of how to apply to child neurology residency, and what the potential issues you might face are, pitfalls, unexpected circumstances, and how to address them. We're joined by 4 excellent panelists who are at all different stages, ranging from the recently matched PGY1 resident all the way to double-decade veteran program directors who have been nationally recognized for their teaching as recently as the last year with Dr. Saeed. And we will be going through a range of questions. The topics are going to be broken down into a few different categories: initial applications, geographic limitations and rotations, how to approach signaling, specific issues of interest to international medicine graduates, and then we'll use any remaining time to try and address questions that you have in the chat and general advice. So I think the first question would be how to plan for a successful child neurology residency application during your preclinical years of medical school. So if you're in the early parts of training, how should you go about differentiating yourself? And I'll first turn it over to Dr. Hatch, since he most recently went through this process. And then from there, anyone else who wants to join in.
Thanks, Dr. Nelson. As you said, I am recently now a resident of, I guess, 2 months. So I'm sort of navigating the whole residency concept, but I was just in your shoes applying for child neurology residency programs, and that's a great question. I'd say the most important thing to do now, would be to identify who your letters of recommendation are going to come from. Make sure that these are people who have worked closely with you, who know you well. Don't try to, get a letter from someone who is maybe the department chair who doesn't know you very well. I think someone who knows you well, knows your backstory, what your goals are, that's probably the most important letter you're going to get. Also, personal statements very important. Everyone has their own story, their own background, their own interests, how they've gotten to this point. I think the child neurology field especially is very interested in your path to this, because it's such a unique field and rewarding field. So focus more on your personal statement, who your letters of recommendation are from, and just during the interview, be yourself. Those are the main tips I have as someone who recently matched and became a resident.
Great. So the next question would be how important or beneficial sub-internships or dedicated rotations are in child neurology during the later portion of training. And so for that, I'd start things off with Dr. Agers.
Thank you, Dr. Nelson. From our standpoint, having done a sub-I specifically is not as important as having done child neurology in general. Definitely child neurology is different from adult neurology. And for programs such as mine that is very busy, having gone to a center that actually has a good volume of patients where you see a diversity of complexities and difficulties will bolster your application. So if you go to a school where there's a smaller specialty field where there's no availability around you, it is okay to seek out and look for away rotations. But it's not the end of the world if you don't do a sub-I properly, as long as you've had some child neurology exposure. It definitely bolsters from that standpoint.
Dr. Saeed, what about applicants who are off cycle? What about those who have had breaks in their training? What are things that they can do that will either help explain those gaps or help differentiate them or help them stand out when they have a non-traditional application?
Thanks for the question, Dr. Nelson. I think the most important thing is to be honest. We're going to see that there's a gap and we're going to wonder about it. So figure out a way to tell us. If it's in your special circumstances box that came up last year, your personal statement, maybe that's a place where you should explain it. Or if it didn't come up anywhere in the application and you still got the interview, because often there's other really strong parts of your application as we look at a holistic review, figure out a way to tell maybe not every single person, but at least the program director. They will likely ask you. And so be truthful. We can tell, when you're not. And we're human and we understand the world circumstance. And it doesn't necessarily mean that that's a negative. Often it's not how we fall, but it's how we rise, right? And so that's what it looks like.
I think everyone takes a very holistic approach to reviewing applicants, which helps in that situation as well. Dr. Gottlieb-Smith, you have a lot of involvement at the national level with regards to changes and evolution of the child neurology residency. So what are trends that are particularly important for applicants to be aware of in the coming year?
That's a really good question. Thanks, Dr. Nelson. I think there are a few trends that are coming up in the upcoming year. There's lots of ways that programs do things a little bit differently. I would say lots of programs are pretty similar in how their overall 5 years are structured currently, just so everyone's on the same page. There's 2 years of pediatrics training followed by 3 years of neurology training. And the 3 years of neurology training are a mix of a total of 1 year of adult neurology and a total of 2 years of child neurology, and programs structure those a little bit differently in those 3 years. I think the big thing that is coming up next year is that the pediatrics program requirements are changing. And so with that, the first 2 years may look a little bit different, likely for all child neurology programs, and different child neurology programs may implement that a little bit differently. There are programs that allow for American Board of Pediatrics certification, and that was the traditional pathway, and some programs have gone to non-American Board of Pediatrics eligibility for child neurology residents, or an option to have non-ABP, American Board of Pediatrics eligibility. All of the programs that you'll be applying to that are ACGME accredited will allow you to sit for the American Board of Psychiatry and Neurology certification exam, which is the main neurology certification exam. So I think individual programs are likely to implement that a little bit differently beginning next year as we navigate that. And then in the future, there's more discussion about the mix of all the different training, including the duration and the pediatrics, adult neurology, and child neurology component. That's not likely to affect next year, and it will probably take several years before that comes into effect.
And to that point, one of the other questions was about a timeline for programs to review applications and send out interviews. And I know there was a lot of discussion about a potential unified timeline, but I don't think there is one officially adopted right now.
There's no official adoption. Thinking about the American Academy of Neurology statement and the Child Neurology Society, there may be one coming soon, but there's nothing official right now about a universal interview offer date.
Then we will keep bated breath, and we'll be excited to hear things if more things come. For Dr. Hatch, so it's a small group of applicants. So I assume whether it be virtual or just in the geographic regions you were looking at, you probably interacted with a lot of other applicants to child neurology last year. Was there anything that stood out to you as something unique or special as far as MD PhD applicants, of which you were one, in terms of the number of programs that they applied to, in terms of other strategies or unique circumstances?
Yeah, great question. Being an MD PhD a graduate now, I was primarily looking at programs that had very strong research programs that had PIs in the field that I want to go into, which is more neurogenetics, neurodevelopmental disorders. And so I was primarily looking at those institutions. I think it was just a mix of where I wanted to be geographically and where I wanted, to do my research and where I could see myself after those 5 years of child neurology residency. I definitely saw some of the same people during my interviews, which was, such a good thing because I was able to connect with each other during those interviews, and we were able to talk offline about what we thought were the strengths and weaknesses of each program. But I think it's such an just a personal decision as to which programs you apply to. I think I applied to many programs because I guess I just wasn't sure how many I would get interviews for. So I applied very broadly. But once I started on the interview trail, I was able to narrow down my focus. I canceled several of my interviews because I knew that, the regions that I wanted to live in and the type of research I wanted to do down the line was more focused. And I became, that vision became a lot clearer as time went on. So Just know that your interests will evolve during the course of the interview season. So will burnout, which is real. You'll get tired about talking about yourself 24/7. So I would say apply broadly. Don't apply to a region where you're like, I'm 100% not going there. Just apply to regions where you think you would live comfortably and they would have a strong research program. So that's my advice for MD, PhD graduates or applicants.
Which is a great bridge to the larger topic of geographic limitations and rotations. And so, we have individuals from Texas, from California, from Boston, from Michigan. And so for our 3 program directors, what recommendations do each of you have for applicants who are geographically limited or may find themselves with a small selection of child neurology programs?
Do you mind rephrasing that, Dr. Nelson?
Yes. So for you, you're out in California. There's multiple programs, but California is a large state. Do you have any recommendations for applicants if they're trying to deal with wanting a specific geographic area and how to approach that, whether it be away rotations, whether it be other experiences, particularly in light of the fact that some programs don't have as many in-house child neurology experiences?
Okay. The way people who've applied to our program and my actual current residents have approached that have been a combination of doing a sub-I at a place, especially if you're outside of the region. If you're from the region, historically, that's your hometown, that's where you grew up. That also kind of gives you, the program directors, we know you have a link to the area, so it makes you think that you maybe want to be in our area most often. If you are outside the area and you're like, I want to be in this geographic area, mark it on your geographic preferences and signal to programs. It's a big thing for programs who see you coming from Maine, who say, I want to come to San Diego. They're like, but do you really? You've never been here your entire life. So if you really have a passion, or you're like, I'm matching with my fiance, whatever you have to try and do to indicate that you actually have a true desire, that's what you can try and do from my standpoint.
Dr. Saeed or Dr. Gottlieb-Smith, what are your thoughts about sort of geographic considerations when you're trying to apply either locally or outside your home geographic region?
Yeah, I agree that you really need to, if it's really about geography, then you have to apply to every single program in that geography, if it really is that important to you. If it's not geography that's most important, then you have to think about things like program size, how happy the residents are, culture, and other things. But if it's really geography, you have to be here because of whatever circumstance, then I think that you have to market yourself and tell us, because exactly that example of the person from Maine who's applying to, let's say, Texas, if they've never been, then we might really like them, but if there's only, we're trying to we're all doing a dance, and we're trying to decide how to match people on a list where many people are very similar. So just really let your intentions be known. Tell me why this is important to you. Texas Instruments is down the road, and and it's great for your family. Perfect. But that being said, I did my training in Boston. I knew no one there, and I went, and it was wonderful. And so that's also really a great, honest thing. Like, I just want to change. I want to see snow. I don't want to see snow. I like the heat, whatever it is. Just give us something that feels, your truth.
And Dr. Gottlieb-Smith, you can chime in, but also, can you just tell those who may not have heard about it, how does geographic signaling even work?
Yes, thanks for bringing that up. So you are able to select geographic regions of the country, and Dr. Nelson will have to remind me, I believe there are 8 total geographic regions, but they're big swatches of areas around the country. And so you can pick 3, I believe, and then you can actually, within that, you can describe why those geographic regions are your preferences. So for example, for me in this upper Midwest region in Michigan, if someone would select this region, I would see it, and you're applying to the University of Michigan, I would see it, and then there is an option to explain why this upper Midwest region. I would not see the reason if you also selected, because you have up to 3, if you also selected the more of a West Coast region, I would not see why you were selecting that region. I would only see my region. I can also see, as a program director, if you select no geographic preference for the entire country, I can see that. Or I can see if you selected my region, I can't see what other regions you did or didn't select besides that. So you can use that to your advantage to really tell that story that you were hearing about why you really want to be in that region. And then you can also use, I think we'll probably talk about preference signaling, but you can use your preference signals to further bolster that. You could choose to use your preference signals for programs within those regions or outside of those regions that you select.
And we'll talk about preference signaling, but you raise a very good point that I just want to reemphasize. So you can select that you explicitly have no geographic preference, and that will show up to everyone. If instead you just don't pick something, or if you pick other regions, it will be blank to the other regions. So you don't want to just leave things blank because everyone will assume you want a different geographic region. So if you truly want no specific geographic region, you should say that explicitly, which is one of the options. And Dr. Hatch, you mentioned that you specifically had a region you wanted to be in. So how did you go about that? What was your approach to signaling in one of the earliest years where it was used?
Yeah, certainly. So I grew up in New York City. I went to the Albert Einstein College of Medicine in the Bronx in New York City. And I was primarily choosing geographic preferences that, were in the Northeast. So I think I selected like New England, the Mid-Atlantic region, and just basically down the East Coast. I did go to college in California, and I loved being in California for college. So I also had tons of friends that were in California. So I also applied to some places in California. I didn't select California in my geographic preferences, though, but I did end up getting interviews in California. So even if there's a program or a couple programs in a region that you don't signal, you might still get interviews there. It's not make it or break it. Program directors take a very holistic approach in reading applications. They'll see if you identify with a particular region. You can also personalize your personal statements for specific programs. So if you're unable to select a geographic region that a certain program is in, you can sort of elaborate that in that personal statement for that program.
But then be sure you don't mix them up, because that happens every once in a while.
Yeah.
So beyond that, in terms of approaches to signaling, you should always talk to your home institution, because each institution sets their own expectations about whether an internal candidate should or should not use one of their signals. Same thing for if you've done, but it's a concern for our program directors, maybe starting with Dr. Saeed. What is your stance on visiting electives and their relative importance?
I think that for people who are in smaller programs who really need to decide if this is going to be their thing, and especially as we are a smaller field in some places, I think it's really important. You're making a decision just looking at it as the individual, you're making a decision about your entire career. And if you only did a 2-week rotation in your medical school years as part of a larger adult rotation, you may not even really be certain that this is what you want. And so I really encourage people to do an away rotation in that circumstance, just to solidify that that's important to them. Beyond that, we really look at applicants very holistically. And if they are telling us the right reasons, if they've gotten even a great letter from, let's say, an internal medicine doctor, which is usually busy at their program, and they really know them, and they say something at the end like, I really am sad that they're going into child neurology because they were all these wonderful attributes. That gives power and weight, because I don't honestly believe that they have to have invented the next device or become a child neurologist to join my program, as long as they've got the intellectual curiosity and the conviction. because my worry is sometimes when they go do those 2 years of peds, if they weren't really sure that they wanted to do child neurology, every now and then, you know, we might lose someone to pediatrics who just didn't get enough of a neurology experience. So it's more for the applicant than it is honestly for me.
Dr. Agers, we've done preference signaling only recently and geographic signaling. It's different for different specialties. Some specialties have a lot of signals. We have only 3. So how important is it to signal a program either geographically or individually?
It's very real importance, but it can be very important if you're not near that institution. If you didn't get a chance to do a visiting elective, which, as Dr. Saeed said, yes, you can do a visiting elective in other places, but if I got to go to Stanford, but not UCSF, and I want them to know that I really want to go there, I should either signal them directly and put a geographic preference to the West Coast. For your home institutions, like you mentioned before, it might vary. So for our medical students at USC, I say, don't signal us. We're going to interview you anyway. You get automatic interview beyond the people we interview besides that. But not every program does that, and they still want you to signal so they know that you maybe want to stay home. So I think it's important to signal a program that you really, really want to go to, that to help bolster your idea. Because when we did our holistic evaluations, if there are people who are on the bubble, the person who signaled us might have gotten an interview over the person who did not signal us.
And given the guidance recently put out by the American Academy of Neurology, Dr. Gottlieb-Smith, you recently alluded to the fact that there may be additional guidance, but I think it's fair to say that the majority of interviews are going to be virtual this year, as they have been in the past. So what are advice that you would give someone regarding how to approach virtual interviews, both scheduling and execution?
That's just a good question in terms of virtual interviews overall. And so do you mean in terms of the logistic setup? Well, I think you asked first about scheduling. One thing about scheduling that I was alluding to is there may be a universal interview offer date coming for child neurology. And so there'll be more information about that coming out if that's the case. But generally, if that is or isn't the case, you'll get an email from programs through some sort of, typically directly from the program coordinator or through a platform like Thalamus, which many of you will get very used to, that will allow you to schedule interviews. The tricky thing on the applicant side is really actually scheduling. We know that you're very busy with clinical rotation, so actually scheduling can be tricky. So making sure you give yourself some time to plan out and have a really organized calendar system for yourself to plan out those interviews, which may be 1 or 2 days for each program. Just keep that in mind as you're thinking about rotations and as you're scheduling. And I think that Dr. Hatch may have some more information about that, having recently gone through that. I think separately things about, virtual interviews. One thing is that time zones matter. And so if you're in a different time zone, just keep that in mind, because you don't want to show up to an interview late because it's a different time zone. So keep track of that in your calendar as well. And just make sure you have a kind of a space that's conducive to interviews. I think people have a lot of concerns about doing different types of backgrounds. And I think whatever people are most comfortable with is generally what I say to go with. I'm using a virtual background right now, but making sure you have a setup that works if it's Zoom or another platform, making sure you have the audio and video and have a good location for the Zoom itself. I'll leave it to others if they have more thoughts too.
Yeah, Dr. Hatch, what was your experience doing virtual interviews? What worked well, or what do you wish you'd known at the start that you figured out partway through?
I think I severely underestimated the toll that virtual interviews would take on me, especially since I applied very broadly and I accepted many interviews. I just remember there being a 2-week stretch where I had an interview every single day, and it was probably not a wise decision. Just remember, as others have said, that usually you'll have a pediatrics day, you'll have a child neurology day. For those who are MD PhDs who are interested in research and want to continue that, there might even be an additional research day, and some other programs have separate interviews with a child neurology interviewer, or sorry, an adult neurology interviewer as well. So you're going to have to sort of schedule all these along with many other social events. Some programs have, special socials like a resident social or a diversity social, some other socials. So just keep that in mind when accepting the interviews for these programs. If you see that you are getting a lot of interviews, maybe be more selective in which ones you take. But most of my interviews were in November and December. I had a couple in October and January. So just know that by December, early mid-December, you'll probably be a little burnt out if you're accepting a lot of interviews. Just know that.
Burnout is not good in any circumstance, and is best avoided if possible, given you'll be doing a million other things at the same time. So let's go around sort of quick reactions for our program directors. I'm going to run through a few different things that applicants would like to know how important they are. So, shelf exams for neurology, how important are those?
Not really that important overall. It's part of your grade, and I want to make sure you did well on your neurology rotation. But a lot of it is the words, like what people say about how you did, is a little bit more important to me than a number. Although the number is often helpful in clerkships where they're trying to find some sort of standardization so that it's not all subjective comments.
What about passing step 1 on the first time versus perhaps needing to take it more than once? Someone else.
Dr. Eggers, you can go ahead.
For our holistic process, we align with our PEDS program. And so not passing step 1 the first time is not the big issue, but failing 2 step examinations is a big issue for our program because we align with our pediatric program.
And Dr. Gottlieb Smith, for DO applicants, how important is it to have a USMLE exam as opposed to a Comlex exam or score?
That's a really good question. We previously at our program had required USMLE scores. We no longer do, and so we use Comlex scores. But that's going to be very specific to the individual program. So I definitely would look at websites because they should have specific instructions. And if you have questions, this is a big deal in terms of the testing you take, the financial resources to do that. Please email ahead of time so you can ask. Program coordinators, program directors will be happy to answer those questions for specific programs that you're looking at. But not all programs are going to require USMLE. We don't. We take Comlex scores as well and review those. And then the other thing that might come up just to add is that if you have failed a step exam or an exam, that's a perfect place to include specific information about that in your impactful experiences section. I love to see a story of kind of what changed that you didn't pass the first time, how you dealt with that, and then hopefully there was a successful outcome the next time you took it. And so that's something that goes in I think there's questions about holistic review, for example, for resilience. And that's a big piece of information that we look for in our residency applicants too.
So Dr. Hatch, you're an MD PhD. You and I know this personally. You have done more research than perhaps the average child neurology applicant. But what was your approach when you needed to come up with letters of recommendation? You don't need to tell us who, but just what was your strategy in terms of who they should be from?
Yeah, so great question. So since I was an MD PhD student, I obviously got a letter from my PhD advisor who had known me for 5 years. I was in her lab for 5 years. That was a very strong letter. I knew that I was particularly interested in neurogenetics and neurodevelopmental disorders. I also applied to NDD, neurodevelopmental disorder residency program, so I could answer questions about that if anyone has them in the chat. But I did a rotation at my home institution in neurodevelopmental disorders, and that is a field that I love. So I got the director of our NDD institute to write a letter for me there. I got a letter from my child neurology, the head of the child neurology department at Montefiore Medical Center, who is pretty well, very well known. And, you know, he knew me very well based on my interactions with him. So that was also a plus. And I also got a letter from the sub-I, or the AI, we call it, or sub-I director at Albert Einstein College of Medicine for Pediatrics. I know that a lot of people, a lot of medical students try to get a letter from maybe an attending that they rotated with for like 1 or 2 weeks. For me, you know, it made more sense to get it from the AI or sub-I director herself, just because she knew me from my clerkship rotation as well as my sub-I rotation. So, and she just combined what, you know, all the wonderful attendings had to say about me into one great letter. So, you know, try to span the pediatrics field, the child neurology field. And if there's a subspecialty field that you're interested in, maybe get a letter from whoever's in charge of that subspecialty rotation. And if you're involved in research, definitely get one from your most impactful research experience. It could be from, it doesn't have to be from a basic science person, it'd be from a clinical researcher or scientist that oversaw you over the course of, you know, 1 or 2 years. But just be mindful that you sort of you want these letters to draw a picture of you, since program directors take a very holistic approach. They want to know who you are as an applicant, and by, you know, getting these letters from very different sources, it can, you know, paint a very strong picture of you that I think PDs will enjoy reading about.
Yeah. We've already talked a little bit about away rotations, and that they're certainly not required. They can be helpful in certain circumstances. I think if you do one, I think getting a letter of recommendation from someone from that rotation is a very good idea if it's feasible, for use, whether it be for the application to that program or even elsewhere. So Dr. Saeed, you have been doing this, I think, more than anyone else on the call. Suppose you have someone who hasn't done a lot of research. What are the best ways that they can approach their letters of recommendation to try and paint a good picture of who they are? What would be your recommendations?
Definitely get letters from people who know you really well. It's really not helpful to get a letter from a chairman of something if they don't actually know you. You need people who know you and can talk about your strengths. When you're on your rotations, whatever they are, be interested, be intellectually curious, do the extra steps, spend time with the family, examine the child, you know, really do those things that allow you to stand out, so that when somebody comes to write your letter, they know you. Ask them questions, ask to be in their clinics. Like, these things are giving you time points. If you, let's say, did a rotation and you're working with many people, ask whoever's managing that rotation for you, who is going to write you the letter. You know, if you're spending a lot of time, could the person who set it up, could the program director write the letter? Could the rotation and faculty advisor, who's a neurologist? Those are going to be the things that are really helpful. But show up every day with your best foot and consider it sort of like a job interview. It's not only for you to learn that you love the field, but also, you know, that's who you are. And especially if you're doing an away rotation, sometimes we meet people and we're like, we kind of wish we didn't know them because we kind of thought they looked better on paper. So if you're going to be there, you know, be there.
Yeah. And for international medicine graduates, doing visiting rotations or visiting electives are a large part of sort of trying to break through. There's a fair number of international medicine graduates. One of the first questions, which comes up a lot, is about the stigma associated with being an international medicine graduate. And it's one of those tough topics, right? Because if you ask any individual program director, no individual is prejudiced against international medicine graduates. Yet if you look at the statistics, clearly they face an uphill battle. Clearly there is an issue there. And so I don't think it helps to pretend that there's not. And so given that, what are the best recommendations that you would have as a program director? And we'll start with Dr. Agers. What would be the things that would facilitate an international medicine graduate standing out from all of the others, with the understanding that it may be a large field?
Ooh, that's difficult. It can be hard. One of the things that brings people down, I think, is the way the IMG application compares to the state side application when you go to holistic ranking. So some of the tangible things that people will rank at, as far as the way the commentary is said, the way the remarks are said in the letter of recommendations, aren't as strong from an IMG. You might get a paragraph and a half that's not very detailed, not really talking to your strengths, to what you've done. It's more like, they're a good person, they'll be a great doctor, versus a stateside one that's like, this is the most amazing person ever, I want to take care of my kids, I hope they join me in surgery. That to me is more beautiful than you're a nice person, you do well. So if an IMG could do one of many things, it'd be to shore up their letter of recommendations. Most often IMGs have amazing step 2 scores, amazing step 1 scores. And it's not just the scores that feed into it. Your commentary you get on your dean's letter, the company rotations usually aren't as bulked up as the stateside programs as well. So that's one of the biggest things, is if you can help your deans, your attendings bulk up the commentary they give you on your letter of recommendation, your dean's record, I think that would help bolster your overall application. And I'm not sure if Dr. Saeed, Dr. Gottlieb-Smith agree, but that's been an experience I've had over the years. I've been program director and social program director for 2 different programs.
One of the other questions has to do with sub-internship opportunities for final year international medicine graduates, and sort of ways to get that experience in the United States, to potentially get that sort of a more US style letter that is more differentiated, that also demonstrates that you've been able to work within the US hospital system. And one of the things that you'll encounter is that only certain locations are available for you to rotate. And for that, you'll need to look at the individual school site, because and it will usually be spelled out whether or not they are even open to that. And some are not. If they are, then the process will typically be spelled out. Similarly, my experience is having a specific mentor or a specific individual who knows you well, or a specific research project, something that, yes, goes beyond what Dr. Agers was talking about a more generic letter from a brief clinical rotation, which is what the majority of the letters look like in my experience as well. Another thing that is often stigmatized is individuals who take a year off from medical training and have a gap. Dr. Gottlieb-Smith, what in your experience is a good way to approach a gap in training, both in the interview process, but also in terms of fielding a competitive application?
Yeah, I think this happens very frequently, that people have gaps for whatever reason. I think, like Dr. Saeed said earlier, explaining why that took place. And if it's something that happened and you've overcome, that an experience, people take leave for very different reasons, that's a great place to put information in your impactful experiences section, to explain that, or in your personal statement of why that was the case. That could be for whatever reason, or you could have taken a research year, for example, but explain to us what you've done during that time that you were out of the clinical training pathway. Many people take time off for many different reasons, just to let everybody know. And so it's okay. This is something that's absolutely okay. And just explain why. And you can explain as much as you don't have to explain the details if you don't want to explain the details in your application, but a general understanding of what you did during that year, what you learned from that year, how it affected you, will be really helpful when people are reviewing your applications. Like Dr. Saeed said earlier, we will notice if there's a gap, because you put the dates of your training in. And so the program directors, the program reviewers are going to notice if there is a gap. So just make sure you know that it will be noticed. So you should explain why that's the case.
And there's data that exists about sort of what that does to odds of matching with the gap year and with other things. And so it's a situation where different types of child neurology residencies may be more or less competitive. You have categorical programs that you apply to directly out of medical training or with no graduate medical training required, but then you also have advanced or reserved positions where you may be matching primarily for 3 years of neurologic training and not the preceding years, which you still have to have done. But again, you may find that it is easier to apply to or match in a general categorical pediatrics program and then do the secondary thing. Even though there's far fewer of those programs, they tend to, all things being equal, fill with a higher proportion of international medicine graduates than the categorical child neurology residencies. So speaking of different training pathways, there have been questions about sort of the Neurodevelopmental Disabilities Fellowship that Dr. Hatch referenced before, and I know he was typing an answer, but can you tell people what that is?
Yeah, so basically neurodevelopmental disabilities pathway is similar to child neurology, but it focuses on neurodevelopmental disorders. So this may include certain like neurogenetic conditions that some genetically acquired. So it's a 6-year training program that includes an NDD year, child neurology years, and pediatrics years. There is now a shift to many programs offering a 1-year NDD fellowship. I know that Johns Hopkins has one, Boston Children's has one, or will soon have one. So if you're sort of between child neurology and NDD, just know that there's, it is possible to, apply directly into child neurology and then afterwards apply to do a 1-year fellowship in NDD. If you're sort of, afraid of committing this early on, if it's something you're not sure about. But yeah, it is a 6-year program and it includes training in, being in clinics, for example, with maybe children who have like cerebral palsy or other neurodevelopmental conditions. It also is very rich in research. So if research is something you're interested in, like neurogenetics research, I would highly recommend looking into these programs. But there aren't that many. I think, it varies depending on the year, but it's usually less than 10 programs in the country. And they take between 1 to 3 people. So happy to discuss this more offline if you're interested in, but it is okay to dual apply. Most programs know that you're dual applying if they see an NDD application, and they won't ping you if, or they won't, it won't affect your chances of getting into either one.
Some of the more general questions have to do with sort of nuts and bolts statistics. What is the projected match rate? What are the difficulties in different tracks? For that, I'd refer people to the statement recently put out by the American Academy of Neurology as part of sort of upcoming match guidance, where a lot of those numbers were crunched and actually go through that for people who find that sort of detail useful. On a more general scope, so, all of you are child neurologists. It's a relatively niche field, as we've talked about. It's a smaller application pool. It's a smaller pool of neurologists nationally. So for each of you, I thought we could go around and just take 30 seconds or a minute and tell us both why you chose child neurology, which may be hard that amount of time, but also what made you pick child neurology over adult neurology specifically, because a lot of the applicants here may be weighing either option. And so I'd start with Dr. Gottlieb Smith.
I love answering this question. I will also say that I love adult neurology, pediatrics, and child neurology. So I think you can't go wrong in any of those fields. But child neurology is the best. So hopefully you all will decide to choose child neurology. I think it has the intellectual piece of adult neurology, the localization, and add to that working with children is the best. They are so resilient, it's so rewarding on a day-to-day basis. There's so much creativity, and there are so many exciting new treatments that are on the horizon, both when I started residency training and before and now. This is a really exciting time for child neurology, and I hope that you are all very excited to be a part of it. I think that was 30 seconds.
And Dr. Agers, why did you choose child neurology and child neurology over adult neurology?
Adult neurology was never on my radar. Mine was child neurology over pediatrics. So I am a diehard. I wanted to be a general pediatrician for many, many, many years, many, many moons. I love epilepsy. I'm an epileptologist. And that was one of the things that made me say, maybe. And then I actually was really intrigued by Duchenne muscular dystrophy. My college honors thesis was on Duchenne back in the late 90s, before they even knew what the gene really was or things were happening. So that drove me to say, I think I like child neurology, but I actually did all 3 years of peds because I was on the fence of what if. So I did 3 years of pediatrics and applied in a reserve spot and got into child neurology after that. So I did 6 years of training, 3 years of peds. So I'm a general pediatrician and a child neurologist, but my general pediatrics relates to family matters otherwise. But yeah, adult neurology never interested me. I love kids.
Likewise, no offense to the American Academy of Neurology who was hosting us. I would have either been a child psychiatrist or a developmental and behavioral pediatrician before I would have been an adult neurologist as well. Dr. Saeed, did you always know you were going to be a child neurologist, or what was your pathway?
So I actually thought I was going to be a pediatric hematologist oncologist, and I did my pediatrics residency, and I was in a 3-year peds residency, and I was kind of disheartened by pediatric hemonc. I was like, we're celebrating that the platelet count went up and then the child still didn't make it. And it was just sort of this really important crossroads because I had to think, what was it that I loved? And so I tried nephrology, and I realized that that wasn't what I wanted to do. And I just went back to where I'd always found joy. So if you bought a new pack of colored pencils and were sketching out decussations and pathways, and everybody was complaining about the neuroscience course and you thought it was like really cool, then maybe this is your path. And that's where I kind of went back and I thought, this is really it. And so I finished my 3 years of peds and then did my child neurology residency and really loved general neuro, but epilepsy kind of was the cat's meow for me. And I think the other really cool thing is everything I'm doing today in my practice was probably not even something that I was even taught in my residency. We have just moved so far ahead, and it's very dynamic and exciting, and we will never be stagnant. There's so much more to discover. And we're all now geneticists, which is the other thing. So if you need to do one rotation before, do genetics, you will be better for it.
I know other leaders in our field who are not on this call who would strongly agree with you, but it's genuinely true. Like we are now curing things that were in the span of the last decade considered incurable diseases, which is quite amazing. Dr. Hatch, you made the decision most recently of anyone. Why did you make the decision? And you talked about sort of weighing options between different tracks. Why did you choose the pathway you did?
Yeah, so being an MD PhD student in my MSTP program, I knew that neurogenetics was a field that I was very much interested in. During my PhD, I studied an ultra rare disorder that is genetically inherited that causes intellectual disability, autism, epilepsy, short stature, a whole range of features. And I knew that is an area that I wanted to study later or after residency in my own lab. So I knew that neurodevelopmental disorders and neurogenetics was a particular interest to me, and that aligned better with child neurology than adult neurology, which usually focuses more on neurodegenerative conditions. So it really was based on my research interests, and I also love kids and working with kids, and that's something that I found out during my pediatrics clerkship and sub-I, as well as my child neurology elective. So if you are interested in research, sort of identify the questions that you think you'll want to study later on, and see if it aligns more with child neurology, with adult neurology, with pediatrics, et cetera. But I also sort of had like a gut feeling that I wanted to go into this field, and you'll definitely get that sense during your interviews in terms of the general vibes you get from the people you interview with.
If I may add something, Dr. Nelson, if you want to do pediatrics, you also have to love parents. That's all.
Yes, you're treating the child and their family and their support system and all of the above. That's absolutely true. So family meetings take on a whole new meaning in child neurology versus adult neurology. Absolutely. Dr. Akers, I wanted to return because you alluded to your own training pathway where you did the core 3 years of pediatrics and the 3 years of child neurology training. It's a relatively smaller pathway, but still exists today. And so in the current climate, can you just outline what some of the potential positive reasons are someone might choose to do it, but what some of the potential downsides are? Because I know people are given different advice at different institutions.
Sure. Some of the potential downsides are there are quite a few fewer positions available when you're trying to apply into a reserved spot specifically than there are when you're applying for a categorical or even an advanced slot and you're coming out of medical school. So oftentimes when you're in the middle of your PGY1 or PGY2, you discovered, you know what, I really do love neuro, I really want to do this. You're now scouring and looking for programs to say, do you have an opening? 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 And so you might have to be stuck doing all 3 years of peds, or you may end up having to go to whatever institution's available to you, unfortunately. And it may not be the dream institution you want, it may not be where you want to go. Some of the positives, I was a really strong PGY2 in adult neurology because I was already a PGY4, but I'd done 3 years of medicine. So I was a very strong clinician when it came into my neurology years. And so it allowed me to take time to learn more of the localization, more of the things that are really the linchpin for neurology, because the clinical stuff I could do in my sleep. And so that was one of the advantages of having done 3 years of strong training, having been the senior, having ran the service. So that's one of the things that I could maybe think coming out of being a PGY3, going to a PGY4 to whatever we're going to call it, can be beneficial. And Dr. Saeed probably agrees because she did the same thing as me.
Oh, Dr. Saeed, see, I didn't even realize that. Do you have anything else you want to add then?
No, just, it's going to be scary to do anything in adult, but remember that our colleagues are nervous when they come to pediatrics. And in this day and age, we always have a call a friend option. So don't let it derail your hopes and desires this year of training. And it's been so adjusted that it really is 6 months only of inpatient, and the second half of your adult year is just not that same intensity with outpatient elective rotations and elective time. So don't be fearful of it. But yes, you do know sick.
And we have a lot of questions that we're not going to get to that are all very, very good. For the ones that focus on continued concerns about either gaps or issues in their history, as well as those who are wondering about approaches to personal statement and CVs. The thing I would say as a first-generation physician, talk to someone who's been through the process, get their help and guidance for what a medical CV looks like or what a letter or a statement looks like, but then approach things transparently. And I think all the program directors on here would agree with that. You're far better to give yourself the opportunity to talk about something in an interview rather than hoping it's not noticed, because things are going to get noticed. As we get into our final few minutes, I wanted to go through and let each of you have the opportunity to take a minute and give solicited advice, but really whatever you think is the most important thing that you could add to someone applying into child neurology for this coming cycle. And I'll start off with Dr. Hatch.
Yeah, I think it's very, as an applicant, at least, it's very easy to compare yourself to other applicants, especially, during the actual interview where you see them and you're having small talk and you're seeing their accomplishments and you're like, am I that good? Do I belong in this field? And you start to get like a sense of imposter syndrome. Just know that everyone is, very different. Everyone comes from different backgrounds, has different interests. Some have research experiences, some have no research experiences, some did better on step 2 than others. In the end, it's a very holistic and fair process. And the program directors are extraordinarily nice. I interviewed with most of the program directors on this call, and they were, some of the best people that came across in medicine. So just know that it's a very holistic process. Don't get caught up in the numbers in terms of step scores or clerkship grades or things like that. Just know that the program directors have done this for a while. They know how to identify very good candidates. And during the interview, that's your time to shine, to show them what differentiates you from other applicants. So try not to compare yourself. I know it's very easy to go on Reddit or other internet forums and compare yourself, but try your best not to do that, because everyone is unique and different. And you'll match somewhere. Don't worry.
Dr. Gottlieb-Smith, parting advice.
I love what Dr. Hatch said about really just showing, who you are and not worrying about it as much. I know it's hard when you're going through the process. I know I was very anxious about it. So it's okay to be anxious too, but just know that you're all wonderful. And if you choose child neurology or not, you're still wonderful. And we're excited to get to know you. The thing that I will say is that this is also your time to figure out programs. So really do use it for your own knowledge and understanding of where you want to spend the next 5 years of training, potentially longer if you stay after for a fellowship in that same place. You really want to get to know the program. So do look on the websites ahead of time, ask the questions during the interviews that will help you understand what the program is like. And then you can follow up if you have other questions after. Just make sure you have all of your questions answered so you can make the best decision for your rank list about where you want to go.
Dr. Agers, last thoughts.
Child neurology is amazing. I love it so much. And I agree with Dr. Hatch and Dr. Gottlieb-Smith that, be yourself, be expressive, and be engaged. The worst thing for me is somebody who looks fantastic on paper and is probably a wonderful person, but that burnout has crept up on them and they're just tired during the interview and they don't express themselves. Even in pediatrics, most pediatricians are pretty peppy. They notice that as well. So space yourself, give yourself time and give yourself grace. But enjoy your interview season. I think you guys are all do wonderful and all do well.
Yeah, and enjoy getting to know everyone because it's a very, very small field. Last but not least, Dr. Saeed, any final words of advice?
Yes. So I've been doing this for 20 years. And so this is my best advice to you. One, not all pediatric programs need a separate application, and that can be much cheaper if they don't. So just find out about the individual programs. Don't assume that we're all the same. We're small, but we all have enough variability within us. So check on that. Never come to me at the end of a day and say, I have no questions, thank you. Everybody answered them all. It just makes me sad. You finally got FaceTime with these people and me, I'm your program director potentially. And when you say you have no questions, even if you say it the kindest and sweetest way, I just sort of get so disappointed that you really had nothing at all. Fine, just have a question, put it in your back pocket, ask all of us the same question, just have a question. The other is, I think it can be very overwhelming. And so make a table, make your pros and cons, try and do it sort of as much as you can, same day, end of the day, especially if you're interviewing in a lot of places. They're all going to get kind of mixed up together, and have one place of sort of like general impressions. If a place feels malignant and you're like, yeah, but the name is great, don't go there. We aren't malignant programs in general, but if you really get a vibe, trust that instinct, because you're going to be there for 5 years. And maybe you could do anything for a month or maybe 6 months, but 5 years, these are pivotal years of your life. So culture is very important, and you get that by talking to the residents. So don't not go to whatever every program calls their social, where you have FaceTime. So if you're not meeting residents alone, then something's going on, and I would just ixnay that program. Last but not least is you do whatever you need to stay pepped and energetic. We feel it too. Sometimes I'm talking like, did I already say that? Or did I say it to the person before? Like, we all have those moments, but just really, hype yourself up so that you're ready for the interview, because we're doing the same and we respect you and want to give you our best. So do that, and you get that one time to really shine. And if you foible and you can't know and you need a thought to answer a question, I completely respect the person who says, you know what, I actually haven't thought about that. Can you give me a minute to think? I respect that so much. So don't feel you have to be like super on and witty. And I'm always impressed by the applications. You guys are amazing. And I feel really grateful that you are the next generation of our child neurologists. The field is going to be great. And when people say anything about whatever generation, I defend you tooth and nail, because I see you and you're awesome. Those are my final thoughts.
Excellent. Well, thanks so much to our excellent panelists. Thanks so much to the American Academy of Neurology for hosting us. I'll turn it back over
Thank you so much, Dr. Nelson. Thank you so much, everybody else, for jumping on this panel tonight. And for everyone else, if your question's not getting answered, do not worry. We are going through to answer them. Along with that, this will be on YouTube, so you're welcome to revisit or to send it to your friends who couldn't make it. Thank you so much, everyone. Have a wonderful night.